Hello and welcome to the Practical Pediatric Medical Information Channel. Wow, that's a mouthful. I am MZMD. I'm a board certified pediatrician. I am licensed in several states in the United States. I would like to emphasize that this video and all other videos on this channel are meant to be informational only and are not meant to be a substitute for diagnosis and treatment by your child's doctor. I hope that you will join me on these coming videos, and do not forget to like, share, and subscribe. Remember, subscribing does not mean that you're paying anything, but that's a way of notifying you when a new video has been uploaded to this channel. So let's proceed to the next topic. Vomiting and diarrhea are fairly common in children, and sometimes may lead to dehydration and subsequently to hospitalizations. This video will help you understand the possible causes, the treatment, and also will help you understand when it is time for you to take your child in to the doctor. Vomiting and diarrhea may be coupled together or maybe separate. You may have vomiting and diarrhea together, or vomiting by itself, or diarrhea by itself. Let's start with vomiting and diarrhea together. There are many possible causes, but in children, the vast majority is caused by viral infections. You also may have bacterial infections. You may have food poisoning. You may also have allergies causing vomiting and diarrhea. And in some instances, metabolic or chemical issues may cause vomiting and diarrhea. When diarrhea is present by itself, it again is most likely caused by viruses. It can also be bacterial, parasitic, allergic, inflammatory. Most of the allergic reasons for diarrhea in little children is usually coupled or associated with milk. Diarrhea also in children may be caused by dietary issues. There are some children who are very large consumers of juice, and anything with a lot of sugar, especially apple juice, may cause chronic diarrhea. Vomiting by itself also is most commonly caused by viral infections. However, bacterial infections, parasitic infections, food poisoning, allergies, inflammatory conditions may also cause vomiting by itself. Intestinal obstruction, appendicitis, and increased pressure within the brain may also cause vomiting. Now, there are also infections elsewhere other than the gut that can lead to vomiting. Severe ear infections, urinary tract infections, pneumonias are some of these extraintestinal causes which may lead to vomiting. In addition, in teenagers, we have to consider pregnancy when we see vomiting. If vomiting is coupled with severe abdominal pain and fever, we have to think of appendicitis. So depending on what is associated with the vomiting, our diagnosis of or possible diagnoses may change, but the vast majority of vomiting in children is still caused by viral infections. So how do we treat vomiting and diarrhea? So vomiting, we actually can help with medications which work on preventing or controlling nausea. Once we've done that, our next step would be to replace the fluids that have been lost or to rehydrate the child. The primary replacement fluid for children is Pedialyte. If you're unable to obtain Pedialyte, then Gatorade would be an okay substitute. However, Gatorade is not as good as Pedialyte, so your first replacement fluid, if possible, should always be Pedialyte. We do not treat diarrhea in children with medications because medications may not only have side effects in children, but they keep the virus there longer because they affect the motility of the intestinal tract. So what we try to do in children with diarrhea is to flush the virus out of the intestinal tract as soon as possible using the rehydration fluids. So again, antidiarrheal products are not utilized in the treatment for diarrhea in children. The most important treatment for diarrhea in children, presuming that nausea is no longer present, is to make sure they start having solid foods. The more solid foods they eat, the quicker the diarrhea gets better. Now, there are certain solid foods that help more than others, and we have something that we call a BRAT diet, B-R-A-T, B for bananas, rice for rice cereal, A for applesauce, and T for toast. These things will help firm up the stool. However, any solid food would help with diarrhea. There are some exceptions. So anything that has a lot of sugar in it will make diarrhea worse. That is why juice will make diarrhea worse, and we want to stay away from juices when a child has diarrhea. In some cases, dairy products will also make diarrhea worse. So milk and cheese we want to stay away from. In infants who depend on formula and breast milk, we do not want to stop those things in the diet. But with older children who are eating food where dairy products are not totally necessary, it may be helpful to decrease the dairy consumption. If your child has fever and has nausea and vomiting, the only medication you should be giving for that fever is Tylenol. Ibuprofen has a tendency of irritating the stomach lining and may lead to more nausea and more vomiting. So in the case of a fever or headache where there's nausea and vomiting involved, the best medication would be Tylenol. So when should you consider taking your child to the doctor if they have vomiting and diarrhea? So the main reasons are signs of dehydration or prolonged symptoms. So mostly if you have vomiting and diarrhea in viral infections, the vomiting will last for about 1 to 2 days at most. Diarrhea may last anywhere from 3 to 5 days. So in the case of diarrhea, if something goes past 5 days, then you do want to take your child to the doctor. And in case of vomiting, if it goes past 1 day, you need to see the doctor. In addition, if there is dehydration, regardless of how long it lasts, or signs of dehydration, I should say, then that's another reason to visit your doctor. Signs of dehydration in little babies or infants, they may present with irritability, decreased urination, and decreased activity or lethargy. In children, they may present with decreased activity and decreased urination. So if your child has vomiting and diarrhea or either, and they are having decreased activity or becoming lethargic or are not urinating within 4 to 6 hours, then those are signs of dehydration. Also, in some children, when they are getting dehydrated, when you look at their face, their eyes may appear sunken into their skull. And that's another sign of dehydration. However, the most important things are lethargy and decreased urination. If your child is becoming dehydrated, they may need to have IV fluids, which would rehydrate them. Now, other reasons for you to see your doctor in a case of vomiting or diarrhea with children is if there is high fevers, if there is severe or persistent abdominal pain, and also if there is blood and mucus in the stool. So if there's blood and mucus in the stool, persistent abdominal pain, or high fevers, those are other reasons that you should see your doctor in the case of vomiting and diarrhea. So in summary, there are many reasons for children to have vomiting and diarrhea. In the vast majority of cases, it's because of viral infections. The symptoms of the viral infections may be there in the case of vomiting for 1 to 2 days, and in the case of diarrhea for 3 to 5 days. Treatment involves stopping nausea and replacing fluids, and in the case of diarrhea, increasing solid food consumption, which will help firm up the stool. If your child has prolonged vomiting and diarrhea, or signs of dehydration, or has blood in the stool, high fever, or significant abdominal pain, they should be seen by their doctor. Hopefully this information has been helpful to you. This is MZMD wishing you a healthy life.